Hi, I'm Dr. Parcells. I'm an orthopedic surgeon with Seaview Orthopaedics, and today we're going to be discussing knee injections. The typical use of a knee injection is for arthritis in the knee, and it's a really important part of the treatment profile for arthritis. Arthritis is a progressive degenerative condition where you lose cartilage in the knee over time. There's two types of main injections that can be used to reduce the pain and swelling associated with knee arthritis. It's oftentimes a really great way to delay the need for a more aggressive surgery, such as a knee replacement. And the two major types of injections are gel injections and cortisone injections. And they actually function quite differently. So let's spend a little time on each of them, and then we'll also kind of quickly demonstrate on a model how the injection is given. So a cortisone injection is a combination of a steroid called methylprednisone and lidocaine. So the steroid is a very, very strong anti-inflammatory. The molecules from the steroid actually bind to the DNA of cells within your knee and prevent the release of inflammatory molecules. It doesn't actually address the underlying arthritis. It's meant just kind of as a salve or a band-aid on the situation, but it does work really well and can last a number of months. So when we're preparing a steroid injection, we're using 1 milliliter of the steroid in combination with 9 milliliters of a lidocaine, which is kind of like what you get at the dentist to numb a tooth. The idea is that the lidocaine works very quickly and helps to relieve some pain, while the steroid actually takes 2 or 3 days to ramp up. The other type of injection that we were talking about is a gel injection. A gel injection works by getting between the bones and acting as a lubricating agent to reduce friction and thus reduce inflammation. This is one example. This is Orthovisc, and when you open the box here, you can see that there is a single injection syringe. You either get a series of 1 of these shots or a series of 3 of these shots, and this will get injected into the knee. Quickly look at the knee here. This is a model of your knee, so here's the front of the knee. Here is your kneecap, and the goal is to get the medication in around the joint. The whole knee itself is actually covered in a big bubble, which is called a capsule, and that holds the normal joint fluid in position. Once the medicine gets within the capsule, it freely floats around the whole knee. So the medication, even though it's going to be injected on one side of your knee, it will travel everywhere. So when we do the shot, we either place it on the outer side or the inner side of the knee behind the kneecap, and then the medication will travel everywhere.